Hi guys, this is me Gayatri Akil and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. Here I would like to discuss with you all about 29th of April 2023 OET exam, in which I would like to share with you about OET writing. Okay, so let's move on to the case note. So what was the case note? It was an unknown case letter, writing a letter to the community nurse manager who is going to arrange a community nurse for the home visit after being discharged of the patient. Okay. So what is the patient name? Patient name is Mr. Alan Pearson. He is 83 years old. So what is the social background of Mr. Alan? Alan is a retired heat engineer and he lives on his own, though he has a daughter who is living in abroad. And he has the habits of drinking and smoking. So he smokes almost 4 to 6 cigarettes in a day. And also he drinks 14 liters of alcohol per week. He is on Ramipril 5 mg for his hypertension, and also he is taking paracetamol PRN, which means whenever required, for his osteoarthritis, and he has a hobby of reading books. So this is about the social background of Mr. Alan. Okay, so now we are going to see the present medical history of the patient. So what is the present medical history of Mr. Alan? Actually, Alan has been suffering with the severe redness and swelling and the calf muscle pain of his right hip. Thereby, he gone to his GP very recently, and the GP advised him to take an X-ray. And the second visit, he gone with the X-ray report, and the X-ray report revealed that his left hip has got some deterioration. Thereby, the GP advised him to admitted in the hospital for the further treatment and management. So, as per GP's request, Mr. Allen got admitted in the hospital on 5th of January 2023. Okay. So, during the admission, they have done an assessment. On the assessment, they came to know Mr. Allen is suffering with the severe swelling, redness, along with the calf muscle pain on his left hip. Thereby, they have done a D-dimer test in terms of to confirm that the patient is having DVT or not. Unfortunately, Mr. Allen has DVT. So, they have postponed the total THR, total hip replacement surgery, after 3 months. So, meantime, Alan is receiving the treatment for his DVT. The treatment number 1 is anti-inflammatory medications, number 2 blood thinners, number 3 anti-embolic stockings, and patient is being discharged to home with the help of community nurse home visit. So what the community nurse has to do? Discharge advice. The community nurse has to do a daily home visit to Alan's house and to look for DVT complication. Does Alan have any redness, swelling, or any pain? And also she has to make sure that Alan is wearing the anti-embolic stocking on his right leg, and also she has to make sure that he is compliant with the anti-inflammatory and the blood thinners. Apart from that, Alan is having the next appointment date is February 18th with the ultrasound to check that how the DVT prognosis. Okay, so this is the overall case note about the Mr. Alan Pearson. So now, how to write a letter? So to write a letter, first thing we need to know the date. So in the case note, they have given today's date as 7th of January 2023. So that is the date we are writing on the top of the letter. Next, writing an address. So here we are writing a receiver person address. Who is the receiver? The community nurse manager. So we are writing community nurse manager. If they have given the name, you can write Miss or Mrs. Like you can write the title and then write the name, and then you can write the designation of the person, and then you are writing the entire address, but one by one. When you are writing address, always make sure the first letter of the each word should be capital, should not use any punctuation. It should be a plain address, and then you have to write the name. If they not given the name, better to start the address always with the THET, and then writing the salutation. So dear sir or madam, or dear, if name has given, write the surname of the person, and then if they not given the name, only they have given the designation as a nurse, you can write dear nurse. Okay, and don't put comma after that. And then reference, write the patient name. Patient name is here Mr. Alan Pearson, and write the age of the patient. It is 83 years old. Now coming to the point of your introduction. To make an introduction, actually we need 3 things. One is patient full name, second one patient diagnosis, third one is purpose. So most of the students may have a doubt regarding writing an introduction. Either should I write the DVT or I should write the total THR. But here I will say better to write the DVT, because THR is not yet happened to the patient, and also it is postponed after 3 months, isn't it? So there is no point of writing the THR in your introduction. Instead of that, you can go for the DVT, because currently patient is diagnosed with a DVT and also patient receiving treatment for the same. So we can start the introduction like this. For an example, Mr. Alan Peterson, who is recovering from DVT, who is receiving treatment for DVT, who has been recently diagnosed with a DVT. Either three way you can write it, and the purpose, he requires a community nurse home visit for monitoring DVT complications. So you can make an introduction like this. So Mr. Alan Pearson, who is recovering from DVT, who is receiving treatment for DVT, or who has been recently diagnosed with a DVT, full stop, he requires a community nurse home visit for monitoring DVT complications. And then you are coming to the point of present medical history paragraphs. So here also we will be confused. Should I start from the GP's visit or should I start from the hospital admission? So in terms of, to prevent that confusion, we can start the present medical history in a mixed up way. So how? Mr. Pearson. So from the second passage onwards, we have to start the surname of the patient, isn't it? So Mr. Pearson was admitted on 5th of January 2023 with the left hip deterioration symptoms as per his GP's request. So there we have introduced the GP also, and there we have mentioned the patient problem also and the hospital admission also. So Mr. Pearson was admitted on 5th of January 2023 due to left hip deterioration as per his GP's request. On assessment, he was noticed to have calf muscle pain, redness and swelling. Therefore, he has taken for D-dimer test, unfortunately, which confirmed the above mentioned diagnosis. As a result of that, he has been commenced on blood thinners, anti-inflammatory medications and anti-embolic stockings for his right legs. Apart from that, the total THR was postponed after 3 months. Full stop. He is being discharged to home on 7th of January 2023 with a community nurse home visit. Finish. And coming to the social background, Mr. Pearson lives alone and he is a retired heat engineer, or else you can write Mr. Pearson is a retired heat engineer and lives alone. He has the habit of drinking and smoking, in which he drinks 14 liters per week and he smokes 4 to 6 cigarettes in a day. He is on Ramipril 5 mg for his long-term high blood pressure and paracetamol 1 gram whenever required for his osteoarthritis. His hobby is reading books. And coming to the discharge advice. In view of the above, it would be appreciated. Don't use the greatly. So it would be appreciated if you could make a home visit. If you pay a home visit for Mr. Peterson to monitor his DVT complications such as swelling, redness and pain. Then you can most importantly make sure that he wears anti-embolic stockings and complies with anti-inflammatory and blood thinners. And then it is important to note that, most importantly, if you have written, you can write, please note that he has follow-up on 18th of February 2023 with ultrasound for the DVT to know the DVT prognosis or progress. So finish. And then please contact me for further details. And if you have a name of addressing person, write it as yours sincerely. If no name, write it as yours faithfully, but don't put comma after that. It is not mandatory. Okay, so this is the way you can write this letter. So this is a one kind of writing a letters, I could say. So you can write it in a different way, but main thing is it is important to mention the DVT in the introduction and the present medical history paragraph, entire problem of the patient and the social background of the patient, because the nurse is going to do a home visit, so she must know the social background of the patient. Apart from that, what the nurse can do after the patient reach homes. So she has to monitor the complications. She has to make sure that he is taking the medication on right time, and also he wears the anti-embolic stockings. And the third thing, she has to remember the patient that go for the follow-up and on 18th of February 2023 with ultrasound report. Okay, to know the prognosis of the DVT. Okay, so this is a very simple letter. I hope you all have done in a very good way. And also whomever wants to participate or whomever wants to take a class through online in our academy, our number has given in the description, so you can contact us at any time. We have 40 days, 50 days, 60 days and also beginners batch. We are taking only online writing classes, online speaking classes, online writing and speaking classes, and the 4 modules also going on. So if you are having interest to join in our class, you can contact us, and our number has given in our description. So until then, Bye bye.